Hi team, it's Janira Linton-Ozic, and today I wanted to share with you a key hip joint mobiliser that we share in our Holistic Movement Coach mentorship program. So when might you use this hip joint mobiliser? So if you see if someone's doing a sit and reach as their metric or a squat pattern, and you can start to see it's breaking down, but you're not sure where or why. You could ask them, okay, where does that start to feel a little bit gluey or sticky for you? And if they say somewhere around here or around the hip joint region, then you could check with a specific assessment, which is the supine double knee hip flexion test. And so if you can see that one knee is clearly forward of the other, i.e. one hip joint is bending or flexing easier than the other, it could indicate that the joint may need mobilizing or tissue may need releasing. So what is this hip joint mobilizer? So the one I'm going to show you today is a correction for hip flexion or hip bending. So you need a reasonably sized width band, and you want to stand on it a good foot depending on the tension of the band. Now the hip joint that you want to mobilize, that's the one that you band up, and you want to put that band just before the hip bend or hip flexion crease line, just so it doesn't get in the way as we bend forward. And you want to place the back of the hand at the lower back so you get some feedback about what's happening at the lower back as you hinge forward at the hip joint only as far as you can keep a neutral spine, and then you come back up. And you would want to repeat that, maybe sit in it for a second or two, maybe you want to repeat that a good 15, potentially 20 times. And then you would come out and you would go back and recheck your metric or movement that you are finding challenging, and ask your body, does it feel same, better or worse after having applied the intervention? And if it feels better, then you would ask, okay, well, does it feel a little, medium or lots better? So you're asking the body, what's the return on the investment of the intervention? Is it a keeper, or do we need to move on to some release work? So more of that coming. So thanks for joining me today, team. I'll see you soon for more movement and mobility gems.